Dementia is not a single disease. It's a term for a group of symptoms. These symptoms affect memory, thinking, and social abilities. They interfere with daily life. Dementia is more than just forgetfulness. It's a decline in cognitive function. This means a person's ability to process thoughts. There are several types of dementia. Alzheimer's disease is the most common. It accounts for 60 to 80% of cases. Vascular dementia is the second most common. It occurs after a stroke. Other types include Lewy body dementia and frontotemporal dementia. Each type has its own characteristics, but they all share common symptoms. Dementia is progressive. This means it gets worse over time. In the early stages, memory loss is mild. A person might forget recent events. They might struggle to find the right words. As it progresses, they may forget important information. This could include people's names or recent events. In advanced stages, they may lose the ability to carry out daily tasks. It's important to note that dementia is not a normal part of aging. Many older adults live their entire lives without it. However, age is the biggest risk factor. The chances of developing dementia increase as we get older. But with the right information and support, people can live well with dementia. Understanding the condition is the first step. It helps patients and families cope better.
Section 5. Managing dementia symptoms. Managing dementia symptoms requires a multifaceted approach. Medication can help in some cases. Cholinesterase inhibitors are often prescribed for Alzheimer's disease. They can help with memory and thinking skills. Memantine is another drug that can help with cognitive symptoms. However, these medications don't work for everyone. They can't cure dementia or stop its progression. They can only help manage symptoms for a time. Non-drug treatments are also important. Cognitive stimulation therapy can help. This involves activities and exercises to improve memory and problem-solving skills. Reminiscence therapy can also be beneficial. This involves talking about past experiences, often with the aid of photographs or familiar objects. It can help improve mood and well-being. Music therapy has shown promise too. Familiar songs can evoke memories and emotions. They can help people with dementia connect with others. Creating a supportive environment is crucial. The home should be made safe and easy to navigate. Remove tripping hazards. Install handrails where needed. Use labels or pictures on cupboards and drawers. This can help a person find what they need. Establish routines. Regular schedules for meals, activities, and sleep can provide a sense of structure and security. Use calendars and to-do lists to help with memory. Break tasks into smaller steps to make them more manageable. Communication strategies are also important. Speak clearly and slowly. Use simple words and short sentences. Be patient and give the person time to respond. Use visual cues when possible. For example, show a toothbrush when asking if they've brushed their teeth. Avoid arguing or correcting. This can cause frustration and upset. Instead, try to enter their reality. If they think it's 1970, don't insist it's 2024. Ask about their experiences in that time instead. Remember, the emotional content of a conversation is often more important than the factual content.
Section 6. Introducing the Eldercare Mental Health Guide. The Eldercare Mental Health Guide is a valuable resource for anyone dealing with dementia. It's designed to help patients, families, and caregivers navigate the challenges of dementia care. The guide provides comprehensive information about mental health in older adults. It focuses on dementia, but also covers other conditions like depression and anxiety. These often co-occur with dementia or can be mistaken for it. The guide is written in clear, simple language. It avoids medical jargon where possible. When technical terms are used, they're explained. This makes it accessible to people without a medical background. The guide is divided into sections. Each section covers a different aspect of elder care mental health. This makes it easy to find specific information. You don't need to read the whole guide to benefit from it. One of the key features of the guide is its practical approach. It doesn't just provide information, it offers concrete strategies and tips. These can be applied in daily life. For example, it includes communication techniques for talking to someone with dementia. It suggests activities that can help maintain cognitive function. It also provides tips for managing challenging behaviors. These practical suggestions can make a big difference in the quality of life for both patients and caregivers. The guide also addresses the emotional aspects of dementia care. It recognizes that caring for someone with dementia can be stressful and emotionally draining. It offers advice on self-care for caregivers. This includes strategies for managing stress and preventing burnout. The guide also provides information on support services. It lists resources where caregivers can find help. This comprehensive approach makes the Elder Care Mental Health Guide an invaluable tool for anyone dealing with dementia. Section 7. Using the guide, a step-by-step approach. To get the most out of the Elder Care Mental Health Guide, it's best to approach it systematically. Start by reading the introduction. This gives an overview of the guide's content and how to use it. It also explains key terms you'll encounter throughout the guide. This helps ensure you understand the information presented. Next, scan the table of contents. This gives you an idea of what topics are covered. It helps you locate specific information quickly when you need it. Once you're familiar with the guide's structure, focus on the sections most relevant to your situation. If you're dealing with a new dementia diagnosis, start with the sections on understanding dementia and early stage care. If you're further along in the journey, you might focus on sections about managing challenging behaviors or late stage care. Don't try to read everything at once. Take your time and absorb the information gradually. As you read, take notes on information that seems particularly relevant or useful. Write down any questions that come up. You can discuss these with healthcare providers later. Try to implement the guide's suggestions gradually. Start with 1 or 2 strategies and see how they work. If they're helpful, incorporate them into your routine. If not, try different approaches. Remember, every person with dementia is unique. What works for one person might not work for another. Use the guide as a reference tool. Keep it in an easily accessible place. Refer back to it when you encounter new challenges or have questions. The guide can be especially helpful when preparing for doctor's appointments. It can help you articulate your concerns and ask informed questions. Share relevant sections with other family members or caregivers. This ensures everyone is on the same page regarding care strategies. Remember, the guide is a tool to support you. It doesn't replace professional medical advice. Always consult with healthcare providers for specific medical concerns.
Section 8. Support systems for dementia patients. Support systems play a crucial role in dementia care. They provide practical help, emotional support, and can improve quality of life for both patients and caregivers. Family is often the primary support system. They provide day-to-day care and make important decisions. However, caring for someone with dementia can be overwhelming. It's important for families to seek additional support. Professional caregivers can provide valuable assistance. They can help with daily tasks like bathing, dressing, and meal preparation. They can also offer respite care, giving family caregivers a much-needed break. Home health aides, nurses, and occupational therapists can all play important roles. They can help maintain the person's independence and safety at home. Social workers can help navigate the healthcare system and access community resources. Support groups are another valuable resource. These groups bring together people facing similar challenges. They provide a safe space to share experiences and emotions. Members can offer practical advice and coping strategies. Support groups can be found for both patients in early stages of dementia and for caregivers. Many are now available online, making them more accessible. Community services can also provide important support. Adult day care centres offer supervised activities and socialisation. They can provide respite for caregivers. Meal delivery services can ensure proper nutrition. Transportation services can help patients get to medical appointments. Local Alzheimer's Association. Chapters often offer education programs and support services. Libraries and community centres may offer memory cafes or other programs for people with dementia. These services can help maintain social connections and cognitive stimulation. Section 9. The role of caregivers in dementia care. Caregivers are the unsung heroes of dementia care. They provide round-the-clock support, often at great personal cost. The role of a caregiver is multifaceted. They manage medications, coordinate medical care, and handle financial matters. They also provide emotional support and help with daily living activities. As dementia progresses, the caregiver's role becomes increasingly demanding. One of the most important tasks for caregivers is creating a safe environment. This involves removing hazards and making modifications to the home. They might need to install locks on cabinets containing dangerous items. They might need to remove throw rugs to prevent falls. Caregivers also need to be vigilant about wandering. They might need to install door alarms or use GPS tracking devices. Caregivers also play a crucial role in maintaining the person's dignity and quality of life. They help the person stay engaged in meaningful activities. This might involve adapting hobbies to suit the person's current abilities. They also help maintain social connections. This might mean facilitating visits with friends and family. Or it might involve helping the person participate in community activities. However, caregiving can take a toll on the caregiver's own health and well-being. Caregiver burnout is a real risk. It's important for caregivers to practice self-care. This might involve taking regular breaks, exercising, or pursuing hobbies. It's also crucial for caregivers to seek support. This might mean joining a support group or seeing a therapist. Respite care can provide much-needed breaks. It's important to remember that taking care of oneself is not selfish. It's necessary to provide the best care possible. Section 10. Hope and resources for dementia patients and families. While a dementia diagnosis can be overwhelming, it's important to remember that there is hope. Research into dementia is ongoing. New treatments and interventions are being developed all the time. Many people with dementia live meaningful, fulfilling lives for years after their diagnosis. With the right support and care, it's possible to maintain quality of life and dignity. There are many resources available for people with dementia and their families. The Alzheimer's Association is a valuable source of information and support. They offer a 24/7 helpline, educational programs, and support groups. The National Institute on Aging provides up-to-date information on research and clinical trials. Local area agencies on aging can help connect you with services in your community.